So hello and welcome to this press conference from the Minister of Labour, Employment and Social Solidarity, Mr. Jean Boulet, the Minister of Health and Social Services, Ms. Danielle McCann, as well as Dr. Massé. Thank you. So hello, everyone. I am also going to take advantage of this to mention the person who made my mask, a lady Bélanger, Madame Bélanger from Magog. I wish to thank her for this beautiful mask. So, the Minister of Labour, Employment and Social Solidarity, Dr. Massé. Hello, everyone, as well. So I am very happy to be in the presence of my colleague, the Minister for Labour, Employment and Social Solidarity, Mr. Jean Boulet, because we're going to be announcing to you today the gradual resumption of clinical for body care as well as private care. So we'll authorize the following companies to start their activities as of the 1st of June everywhere in Quebec. So it is clinicals for bucco-dental care, the dentistry centers, but also companies from the sector of therapeutic help, such as physiotherapy, psychology, optometry, social work, family therapy, nutrition. So the list is pretty long, and it also includes other kinds of alternative or soft medicine. And you can find the full list on the website of the ministry or on quebec.ca. It will be put there this afternoon. And I would also like to add to this list the toiletries care for animals. As far as for the other recovery, it's going to be done in 2 phases, and I'll let my colleague talk about a few details on that in a few moments. So it is a step that has been very expected and is going to do a lot of good to a lot of people. But of course, we have to, as we always say, this has to be done while ensuring everyone's protection, the protection of workers and of the clients as well. So that is a priority in this resumption. So there will be rigorous prevention measures that are going to be set up because these cares that we're talking of here, many of them remains that there's a great proximity between the clients and the staff. So the Commission of Standards of Equity, Health and Safety at Work, the CNESST, in collaboration with public health and the partners of the different places, wrote up detailed guides for the workers who give personal care, whether beauty care or private health care. Of course, people who have symptoms of COVID-19, we know what they are: fever, coughing, respiratory difficulties, loss of the sense of smell. They must cancel their appointment and must isolate themselves for 14 days. They must contact the 1-877-644-4545 to ask for a screening test as well. At the time of their appointment, people cannot have any fever or have had any in the past 48 hours or any symptoms for at least 24 hours. And a person who has developed COVID-19 must wait 14 days after the beginning of the symptoms for their appointment to be able to take place. Before handing over the mic to my colleague, I would like to talk to you a little bit on giving more details on the bucco-dentistry domain. It is important to remember that the professionals in this domain have in their training a very specific curriculum on the prevention and control of infections. These are people who are very experienced. Disinfection, sterilization are part of their daily work in any dentistry. So for any patients, there will be extra measures that will be installed. For example, where patients have to rinse their mouths with an antiseptic mouth treatment before the treatment. And many measures are going to be taken, of course, by the entire team of the dentistry offices. And the Ministry of Health and Social Services has set up a task force as well as a team of collaborators to emit recommendations concerning the professional way of doing things in this. Up until now, the reopening of the different sectors has gone very well because everybody has been collaborating. So I believe that it will be the same thing for the sectors that we are announcing today. Of course, I would like to remind everyone that all of these easings of the guidelines can be reviewed if the situation should become problematic. We still count on the collaboration of everyone and would like to remind everyone of the very important measures that are, of course, becoming our new way of living. Physical distancing of 2 meters, washing one's hands frequently, coughing in one's elbow, and wearing a mask. So, of course, these measures, the more we deconfine, the more these measures become important, especially that it be done extremely systematically in our daily lives. So we're announcing today a new step for a return to a more normal life. And of course, we cannot slacken our efforts to avoid us having to take a step back. So thank you. Thank you. I'm happy, of course, to be able to salute and confirm this announcement together with my colleague, Danielle McCann, with whom I have developed a personal and professional affinity over time. So I'm very happy to be with her and Dr. Massé, whom you know well from public health. And I am happy to be able to confirm the gradual resumption of activities, therapeutic care, dental care, body care, aesthetic care, beauty care. We realize to the extent to which it plays a role in the collective well-being, whether it be mentally or physically. Of course, this will be done in 2 different phases, as we were mentioning, and as has already been announced to you. We will be authorized to start up with these activities again on the 1st of June outside of the Montreal metropolitan area, as well as Joliette, and at a date to be determined for the MMC and Joliette. In the sector of personal care and beautician care, of course, it includes hairdressing salons, barbers, aesthetic centers, manicures, pedicures, epilation services, skin care, tattoo parlors, piercing, etc. Of course, as I was mentioning, it has a very important place in our economy as well as our society, and we are very conscious of this reality. The sector of personal care in Quebec is about 4,000 companies. There are a lot of independent workers in this sector, employing close to 49,000 people. So that is a whole area of our economy that has a very that is very important. But we had to do it correctly in order to respect the safety and security not only of the people who work in those domains, but also the clients. And for that, I've often said that we could not allow ourselves to make any compromises on this. So it's an important challenge because these are services, proximity services. So we have established, together with the CNESST, who collaborated with public health constantly, so we have sanitary safety guides in workplaces. There's 3. One is applicable for personal and beautician care, one is for dentistry work, and one is for therapeutic care. There will be 3 virtual guides of sanitary and hygiene standards that will contain clarifications that will ensure to all those who are concerned to prepare themselves correctly. So I think we're giving notice that is completely reasonable. For example, identifying the distance that has to be respected by marking the floors outside of the establishment as well as in the waiting rooms. Limiting the number of people in the waiting rooms in order to respect at all times the physical distancing of 2 meters, disinfecting all surfaces, equipment, material that will have been in contact with the clients, installing physical barriers, such as full panels, for example, between the different positions, workstations that would be too close, as well as wearing the mask when the 2-meter distance cannot be respected. As in all businesses, wearing a face covering is very strongly encouraged for clients. The CNESST has also prepared, there's a kit. There's a guide of sanitary norms, and there's also a list, a daily checklist to make sure when people come in or out, whether employees or the clients do respect those guidelines. And there's also little things to put up on the walls. You've seen them already in the manufacturing sector and construction sector, which play a very important role in teaching people what to do, and that's essential. Those tools can be downloaded as of today on the website of the CNESST. And as I was mentioning, they were elaborated with the General Direction of Public Health, the Ministry of Health and Social Services, the National Institute of Public Health, and the different associations who represent the works of independent workers or people who work in the different sectors that we're deconfining today, as well as professional orders. So I wish to thank everybody who contributed to the preparation, the drafting of these guides, and I would like to take advantage to also bring some clarification that the sectors and economic activities that we haven't announced yet are, of course, being analyzed as we speak. We are paying attention to them, and we are having discussions with the authorities of public health, as well as our experts at the CNESST, and they will be communicated on specifically later as far as when the reopening will take place, as well as the modalities having to do with them. We look forward, just as much as you do, to everything reopening, but it has to be done in an orderly way, following the sanitary measures, and of course, gradually. Thank you for your presence as well as for your attention. We will now start with the question period.
Bonjour, Madame McCann, Monsieur Boulet, Dr. Massé. Ça va ressembler à quoi, Dr. Massé?
What will it look like, Dr. Massé, visiting the hairdressers as of the 1st of June? What will be the experience that we will have? In reality, how will things take place? It's very difficult to keep distance with the person cutting our hair. I understand that there might be certain restrictions. How will it take place? Well, to start with, I'm going to tell you it's going to be good for everyone. That's like the first reaction. But more seriously, I think that it will be an experience that will be a little different because people first, we invite people who have been ill to wait before they go see a hairdresser, or people who have symptoms, they should not go at all. So that's the first thing. It's an initial precaution for everyone, pretty much. And taking into account that the distance cannot be respected, people are going to have equipment to protect themselves, as you mentioned. So the hairdressers are going to be wearing masks. They are going to be wearing protective goggles. They will have protective gowns. And we will ask the people who go into the hairdresser's salon to respect the distance with other clients who may be there. And also we will be asking them very strongly, recommending, in fact, that they wear a mask, like a homemade mask themselves when they go in until they get the care. And then the rest is not that different. There will be disinfection of all the equipment in between each person. So all the equipment that will have touched anybody will need to be disinfected. So hygiene measures. There are hygiene measures that already exist, but we're just going to go a great deal further with the protective measures for the workers, but also for the clients. So it will be a slightly different experience, but it's still going to be good. What about the dentists? We saw that there were kind of devices in certain places, in certain countries, these kind of like boxes made of plexiglass. Is it going to be that kind of reality as well? Well, we can't exclude it as something that could be developed. Some people might use that in their practice, but what you'll see a lot more is people who will be using masks on top of the individual protective equipment that is already present and the hygiene measures. I don't want to repeat myself, but the other difference that taking into account that people in dental care use drills that are very high speed and that it can have it send particles in the air, we recommend that the people who are going to be working, the dentists, hygienists, technicians, that they use what we call a mask, like a respiratory protective device. People know that under N95, but in fact it's a category of masks that has many masks of that level. And that is perhaps the biggest difference with the other measures that we will see in most people that will have that will have those kinds of interventions. Another question, because you said we're talking about other sectors, and earlier on Mr. Boulet talked about the other. Last week at the press conference, I don't remember what it was that we were deconfining last week, I can't remember, but you talked about camping. And you said that what seemed to be problematic was the sanitary blocks, because there are places, of course, where everybody have access to certain services and it's difficult to disinfect them, and I can quite understand. But for seasonal aspects, people who have their own RV, for example, could those people not go there, taking into account the fact that today it was announced that gatherings were authorized under certain conditions, etc. Would that not be a possibility? Well, I don't want to make announcements before announcements are made, but you're right. We will be inviting people who have their own equipment with what they need to use that to avoid using the sanitary facilities of other people to protect themselves and protect others, essentially. When it will be time to announce it, we'll do so. So soon? Well, you understand that it's being worked on. Perhaps for Mr. Boulet or Dr. Massé as well, why not impose the mask to clients? You're saying, well, we can ask, but it seems to be not mandatory. What makes it that Quebec can say, well, in that case, when there's an obvious proximity, we'll be imposing the mask to everybody to avoid contaminating professionals? Well, certainly, it is strongly recommended. And in the CNESST guides, I repeat, that were done in collaboration with public health, what I realize, and what I've realized since the opening of the stores that have a door that lead to the outside, is that there's a lot of discipline. People move around in certain businesses, and it is strongly recommended. But what is important is to teach people that the clients be well informed of the risks and the importance of wearing protective devices such as those. Now, we don't want to coerce people either. And if I could just complete, in Quebec, we made the choice of not imposing mandatory vaccination. So people might say, why don't you impose vaccination? Other people have. But we have success rates that are just as good as what is found elsewhere. And it's anchored in our way of doing things. And it's very successful. It's like creating a social standard. That is what we want to do. We want that when people go to public places where there's a close proximity, we want people to wear face coverings. We want them to wear homemade masks, because we believe that it protects other people. Everybody protects themselves. But could a business impose it? We see that Costco imposes it to clients. So could businesses legally impose it on their clients? Well, businesses have the right to refuse clients. It depends on, there's health businesses. It's a delicate. In health, we can't refuse clients. But in the private sector, people can put their own criteria. These are, private clinics, private stores. I don't want to go into that too much, but in the public domain, well, but of course, somebody could say, this goes against my private life, but at the same time, Costco does it for reasons of public health. And I believe that it is justifiable in this context. We have to leave the rules of the market apply themselves correctly, because, as we repeat, it is strongly recommended by the competent authorities in terms of public health. If you'll allow me a question for me, Patrice Bergeron, La Presse canadienne. There's already therapeutic care that is already authorized. For example, for physiotherapists, there's already a clinic that works for, in the case of emergencies. Do we know whether there's been any cases, and if so, how many? How it took place exactly? Dr. Massé and Madame McCann, if you have any statistics on that? I don't have statistics, but I don't have any cases either. None have been reported, so I can't say that it hasn't happened. All I can say is that it hasn't happened, it hasn't come to our ears. But when there are specific situations, we are usually aware, and I haven't heard of any situation linked to that. But there wouldn't be many, because usually the services, very specific services that were open up until now. Well, what has come to my ears is that there are physiotherapists, for example, who have started developing virtual consulting. Well, it's not something that can be done in the case of every problem, but you know, we are announcing today that it's open, but it's open physically. People can go, but there's also virtual consultations that have been done in the context where they were. For example, today we are announcing family, therapy. We are regularizing a situation where there were virtual consultations or telephone consultations that were made. But now what we're saying is that you can also organize services on the premises. And also, let's suppose that, for example, a physiotherapist or a massage therapist will have a series of clients every day, and if one of them were to be infected and the physiotherapist got infected, the massage therapist got infected, it can take 14 days before it's detected. So there will be a series of people infected. What will happen then? What mechanisms will be set up to retrace all those people and put an end to the infection? Well, when a person is infected, we make an investigation and we try to see in the days where the person is at risk of transmitting it, so it's before the person develops symptoms until a little bit after. So we have a window of time. And so we come in touch with all the people with whom that person was in contact, and then we inform those people. And we see whether anybody has any symptoms, and then we can be brought to intervene. But you know, if you realize that there was an outbreak, so many people who were in contact with what we call index cases, you know, a source, well, then we can intervene and see exactly what happened. And if I may, if we refer to a specific case of a work environment or a physiotherapist that receives clients in their private practice, the CNSST has given a list of questions that have to be asked of the person. You know, if they have fever, if they have cough, or any respiratory ailments. As soon as we detect symptoms, particularly in that case, what has to be done is informing the person to isolate themselves quickly, and an investigation will be done, as Dr. Massé has mentioned, to make sure that anybody who was in contact can be tested. Will the government help companies to get all this equipment? Will they supply it? Of course, bigger companies, it might be simpler. You know, they have volume, but a hairdresser alone, what is planned for and what is being done right now, and it's compatible with the laws of Quebec in terms of health and safety. Employers supply the individual protective equipment. What I see in reality is that very often the workers in certain working environments, in manufacturing, for example, in the construction sector, they have their own visor or even respiratory protective devices or homemade masks that respond to, you know, that meet certain criteria. Right now, there's no, the government hasn't been assuming the cost of individual protective equipment. Now, there are workplaces that have felt the need to do training, to adapt their working environment to respect physical distancing, amongst other things, and the PACME has training programs to which companies have access. They're the CR Aracha, a corporation of advisors in work-related health and safety. There's the CNESST, so many organizations that do training to allow or to permit for the adaptation of workplaces, and the equipment are supplied by the employer. With care that is so close, are we expecting more cases of contagion despite the protection? Well, the protection that is being proposed is protection that we already use in many different healthcare sectors. And it's very efficient when it is used correctly, when there's no breach of procedure. So if there's no breach of procedure, that's why that it's important, the guides that are proposed to people so that people see, well, how to put on a mask. But they're not healthcare workers. Well, yes, so there is an issue of learning how to do it properly. That's why we're saying to people, before you open, make sure that you're comfortable with the information and that you have set up your environment correctly. There are already many who know the hygiene and measures. Well, we're talking about, we talked about the dentists who have training and all that, but there's in other places, people are very careful as well. In tattoo parlors, one of the first things that they learn is how to protect themselves from the transmission of infections, but in many other cases, it will have to learn that. It is part of a level of difficulty, and that is why we created tools to help people learn how to do that. But, if it's done properly, there's a very good level of protection. I have a question that would seem perhaps weird to you, but the establishments of therapeutic massages like spas, for example, is that authorized? Are those care authorized? Because, when you get a massage with gloves, it must not be all that easy. Is that authorized? The answer is no. Not authorized for now? No. Because of the proximity? Yes, correct. Patrick Belrose. As far as the Montreal region is concerned, I'm trying to see a little bit here. Massage therapists are allowed, but not hairdressers. But, the proximity is kind of similar. So I'm wondering why the difference in dates in Montreal. Maybe I can start and we'll complete. But of course, we are guided in the metropolitan area of Montreal, as well as the Joliette metropolitan area, by the epidemiological data that makes us be more prudent. And as we say it often, we are starting gradually with the most sanitary way possible. We're starting those activities, and we judged it properly with the perspective of the progressivity to go by sector. So we have split what is therapeutic and what is health from body care that involves more proximity. So, doctor? Well, I don't have anything to add. When you look at Montreal, the R that we've talked about very often, it's a little bit below 1, but very close to 1. So you don't need to increase a lot of activities to have this vary. So that is the first thing. The second thing is that for the Montreal region, we think we don't want to increase the volume of activities too much. Early on, Mr. Boulet talked about 49,000 people. It's a volume of activity that is pretty significant and which generates a lot of people moving around, a lot of meetings with different groups. So this is a volume of activity that we could postpone. So we're very prudent. We want to go progressively, and this is one of the measures to go progressively. So the logic is more in the sense of an epidemiological protection than anything else. If you'll allow me another question, we're talking about healthcare or hairdressers that will be able to open, but a lot of them are in malls. So I presume that for them it's still not allowed? Well, I am happy that you're asking that question because we saw it in the past. We gave the green light to businesses that had a door that led to the outside of the mall. So it's the same thing, not only for body care, but also for the services that I name, therapeutic care. We have to have a door that leads to the outside of the mall and not that leads to the outside of the shopping mall and not inside. That's a very important criteria that has to be respected. You said, therefore, when we add services and care to what we be allowed, but what about what remains closed? We mentioned spas, but are there any care services that have to remain closed right now? Well, in therapeutic care, dental care, body care, aesthetics, I think that it's pretty much everything in what we've just announced to you. For all other activities, as I concluded earlier on, we're going to start again gradually. There are announcements that will be announced in the next few days. Once again, we have to always beforehand make sure that we have a sanitary guide that is in the sector that is being targeted, and the announcements will be done, as I said, in the upcoming days. We will now go to English questions.
Good afternoon. I was curious to hear you about, when you go to the hairdresser, some people are talking a lot with their hairdressers, like there is a proximity, and now it's not going to be normal anymore. It's not going to be as good it was in the back old days, right? Is there a certain amount of fear among workers, hairdressers, and so on, saying, well, we have to develop a new relationship of trust with our clients so we feel protected and they feel safe? Yeah. What type of comments did you get from workers?
Well, I didn't get specific comments, but I'll make a general comment, and I'm sure that my colleagues will want to add to it. But I think it's true that it's not going to be the same as before, but we will adapt. I think as humans, we have a great faculty of adaptation. And for hairdresser, it's going to be the same thing. And again, we're stressing how important it is to follow the instructions for themselves, for the workers, and for the clients. And I think that there is the population as conscientization is much more aware now. We see that people are very disciplined, and we are counting on that. To be able to continue to keep the hairdressers, for instance, open, so we don't have to close it again, and to respect. But it's going to develop, and it's the same thing as now when you see people at 2 meters that are talking to each other. It's very warm, can be very warm, but it's not the same, obviously. So people are adapting. I think we are all adapting, and we'll find new ways to have those moments that we know with the hairdresser where we confide sometimes in hairdresser, but there will be probably a visière between the client and the hairdresser. But I think people will adapt.
And if you let me add something, I think that beyond the adaptation process, people are satisfied with the new standards. Those sanitary standards are very clear, and they refer to hygiene, disinfection, social distancing, and so on and so forth. And people are happy to come and have a service, a personal one, in an environment that is safe. And again, I reiterate that we don't intend to make any compromise in terms of health and safety of the people. And I repeat, adaptation, and I think after this is completed, people will be very happy to have this opportunity. And it seems to me that after a certain period of time, those standards will eventually become permanent in many work environments.
In terms of public health, what we don't want to happen is to have some places being gathering places where people go and meet and discuss for a long time. And, this we wish it won't happen for a while, because this is the risky issue in certain places, not everywhere, but we know that it happens. It's related with culture and ways to go, but at the same time, this is the part that we have to be careful. We ask people to be careful not to do that.
Regarding dentists, I have a question because dentists, when you had HIV/AIDS in the past, they started to put in place more protection. So do you have the impression that dentists were a bit more ready to face the changes with COVID-19?
I think so. I think they have had to cope with risky issues as other health workers, and they did change. They did protect the clients and protect themselves, and I think they are quite ready right now to go on. And you know, the guide that they are proposing, which is a very complete one, is very thorough, and you know, they work on it very seriously. So yeah, we think that they are ready.
Maintenant, question pour Phil Autier de Gazette.
Hello there. I just want to make sure I understand this right. So on June the 1st, all over Quebec except Montreal and Joliette. Why Joliette, by the way?
Because, Dr. Mercier could comment, but there is a situation there that is a little bit more worrisome. The transmission is a little bit more active. And it's a request also from the MRC Joliette to include them in the CMM.
So on June the 1st, in Montreal, all the 4 million people in the Greater Montreal region get is dental care and pet therapeutic and pet grooming.
Yes.
So in Montreal, you can't get a haircut or a tattoo or a...
Not at this point. Not at this point.
How long are they going to have? Will Montreal have to wait?
It will depend upon the evaluation that will be done by the public health. It will come as quickly as possible, but in due course, we will make the announcement.
And people will have to, it's a lot of people, a lot of workers that are not going to be able to do anything.
Yes, but again, we have to respect the epidemiology. It's extremely important that we reopen the economic activities gradually in a safe manner and in compliance with what the data and has to oblige. They have to oblige us to respect, and I think it's fundamental for us in the Montreal community, as well as my colleague said, in the MRC de Joliette, they requested to postpone the reopening of those activities.
But the situation is evolving, and for instance, the hospitalizations are decreasing gradually. But it's not enough at this point. We have to look at other indicators. But what we can say today is that very slowly the situation is improving. And we're crossing our fingers, obviously, because it could change tomorrow. So there is a glimmer of hope that we will be able to open those commerce in the near future.
And Mr. Massé, just how is a physiotherapist going to do his or her work? Someone who's doing physio might have to touch the person. Yeah. How is that going to work with the COVID?
Well, I think the person will just protect themselves. So they, when they see, yeah, exactly. So they'll have to. First you have to exclude people that are sick, or we explain that that's always important, and keep the clients separated one from the other, which is easy in physiotherapy. But then the physiotherapist will protect themselves and protect the client. They will wear a mask. They will wear gloves. If they need to get close and touch the patient, they might need to wear a gown. And they'll change between patients, and they'll disinfect all the material that they have used with the person. So that's kind of what a lot of other health workers are used to do. So they'll do the same, and the protection is quite good when you do that very thoroughly.
And I think it's important to mention for people who have chronic disease or people of a 70-year-old and over to be especially careful. We're saying, they will need to go to some therapeutic services or even personal services where it's available, but to be especially careful because they're more at risk. And if they can have those personal services at home, it's even better. It's even better because they don't move from one place to another. So we recommend very much that they have those services at home if they can.
Ouais, c'est ce qui met fin à cette conférence de presse. Merci à vous pour votre...
This ends this press conference. Thank you very much to everyone for your collaboration.